Good afternoon, everybody. I see a bunch of people are joining this session. We are very happy to have you here. My name is Barbara Costa, and I'm the Business Creation Manager of the German office of EIT Health. And I will be your moderator for this session. In my daily work, I have to support startups to apply to our programs. And since I work for EIT Health, I had to deal with many startups, but let me tell you that Smart4Diagnostics, it is a very special one. First of all, because it is born within EIT Health, and second, because so far they have been extremely successful. So they are born thanks to one of our program, which is called Wildcard, and they started back in 2018. And after that, they joined another program in 2019, the Gold Track, in which we provide mentoring for exceptionally good startups that have a good potential to scale up. And Smart4Diagnostics managed to stay in the program for 1 year, which is the maximum so far. And in 2020, they also hit another great achievement because they got 2.5 million from the EAC Accelerator, which is the accelerator from the European Innovation Council. So I leave the stage now to our guest for today, who is Hans, one of the co-founder of Smart4Diagnostics. Hans, the stage is yours now.
Thank you, Barbara, and welcome to all of you. I see 15 people joining, and I hope this is going to be a very interesting half an hour. As you know, if you do a talk, for a third time, then it either gets really good or really bad. So my hope is that the next half an hour is the best one of these 3 half an hours when we talk about diagnostics and how disruption can happen here. So my goal is actually to not talk about too much about the company, but actually lead with or think with you and discuss with you together and how we see diagnostics and the lab to develop in the next years, and of course how COVID has an impact on this. And I mean, first of all, our central belief is, and potentially also because this is our background, we see the lab, the clinical medical laboratory at the center of gravity. I mean, this is where we have always seen them, and this is where also Corona has shown that they are. I mean, just to imagine the pure number once again, the German number, maybe that in Germany we are approaching now around 2 million COVID tests per week, which brings it up to around 100 million COVID tests per year, or the capacity. So that's an enormous capacity labs have put, let's say, in addition to their normal capacities, out of the nothing, out of the blue. I mean, and that shows how much automized, how much, let's say, digitized, and how much power actually is in the lab itself. And it shows actually also, if you see the outcomes of how many millions of tests you have and how accurate the results are from the lab, how precise the labs are, and how well invested the money was in these last years. But that also shows even clearer, the more you invest in the lab, actually you also have to invest before the lab. And this is where actually not so much was invested in the last 30 years. I mean, it's the same tubes. It's more or less, we have now printed barcodes on the tubes. We don't write by hand, but otherwise there's not so much innovation in pre-analytics. And the results of this not innovation in pre-analytics results actually in a lot of errors. And these errors are not a blame game, not at all, but it shows a room for improvement. It shows that you actually need to monitor the sample much closer. You need to have much more data on the human sample, no matter if it's blood or swab or whatever other sample it is. You want to actually know where it is 100% collected, when it is collected, what type, is it absolutely quality assured, so that once it arrives in the lab, you can process it directly. No human being anymore touching the sample, but full automation on the lab. I think this is the future, and this is where also we see Corona changing this. So actually, what we do at Smart4Diagnostics, we provide a diagnostic data circle. Obviously, it's all about data, and the data that we provide and the data that we actually think is needed for the future of diagnostics is before the lab. This is where data aggregation needs to happen. It needs to happen at the collection. It needs to happen, before the samples actually ship to the lab, during the shipment and the transport, and it needs to be aggregated into the lab where the data is needed for process automation, for speed, and for quality reasons. At Smart4Diagnostics, we have developed a certain set of hardware and software functionalities that is out in the market. It's running in various labs in Germany. It's going to Europe, and we are now approaching the US as well. And what we actually see is the complete change in diagnostics. It's happened not as fast, obviously, as a startup wants it, but it's happening. And with whomever you talk, it's pretty clear that in around maybe 5 years, 6 years, there will be a standard way of collecting data of human samples between the patient and the laboratories. For that, we already offer a solution, and that is, let's say, speeded up much more by Corona. So actually what I want to focus with you on is maybe not so much on our solution. You can ask questions later, and I'm happy to answer all of them. But I actually want to think together with you and explore together with you, how do we see digital diagnostics in the future? Because this is the interesting thing. I mean, first of all, diagnostics is central. This is, I mean, if we do in Germany now 800 million, 900 million samples per year, this is an enormous amount. What we're also going to see is it's going to increase once again. Why? Because Corona changes it. So first of all, what are we going to see? First of all, we're going to see much more testing in the future. I 100% believe. So till today, basically, we have seen regular tests, either because you were chronically sick or ill, or you wanted to have a certain answer on a situation. So you went to the doctor, you had a test being done. And that amounted to these 700 million blood samples in Germany per year. But what we will see in future is that you will also be tested because you're in a certain situation. Because you want to go to an airplane, you want to go into a soccer stadium, you want to go potentially to a different country, you want to travel, you want to be in a hotel. And that testing is not Corona testing, but potentially, because we have learned this from Corona, how efficient and fast and evidence bringing testing is. This can be testing on influenza, this can be testing on a lot of other issues. We want to have answers in future. Life needs answers. So this is why people will be tested in future much more. And we will see in a few years the complete change into evidence-based personalized medicine. And the data backbone for personalized medicine is the human sample. This is what you can get repetitive, and this is where you get the data. Either it's a blood sample or it's a swab, but in order to personalize medicine for you, you will have a sample being taken. So much more testing. Point two, much faster testing. So testing will happen, let's say, as you wait. As you wait to board an airplane, as you wait to enter a soccer stadium, as you wait to cross a borderline, to go to a different country, you will have a test being done. So a test, it's not going to be anymore taken from you and sent to a lab, but it's potentially point of life or point of situations testing. So you get the answer where you get tested. Much faster, much closer, and that will also change how we see diagnostics. And the whole push for digitalization is happened from the patients. And that is immensely accelerated by Corona. So patients, we have seen in talking to many labs is how much labs are rolling out now their order entry systems. So their digital communication of orders and information to collection sites. Why? Very easy, because the patient wants it. Because only if there's a digital communication to the order site, to the collection site, for example, Corona results can be directly communicated to the patient. They can be communicated much faster, and they can end up at the cell phone of the patient. Because if this communication is much faster, then the patient has the result to return faster to the job, to go faster to a holiday, or to potentially to be faster out of quarantine. And this change comes from the patient. It comes at the moment for Corona, but it will also come for future diagnostic issues. So that brings also the question up, who is in the driving seat of diagnostics? At the moment, you might think it is, or maybe they are still, the big lab chains, the diagnostic industry, the big IVD manufacturers. But this could very much be disrupted in the future. Why could it be disrupted? Because the sample flow itself might not change. It always starts with a decision, I want to have an answer, until you receive the answer. But who triggers this sample flow? At the moment, it's a doctor, and that doctor is in a certain kind of a relationship with a lab where a certain machine is. But in the future, the patient, might trigger the sample flow. And for us, it's irrelevant actually in what kind of lab chain the sample is analyzed and what kind of machine is standing in the lab. So that changes the dependencies in this diagnostic circle. And that changes actually, who depends on whom. So you as a patient could give the sample to anybody to just bring you back the result. So this could result in a complete new structure of diagnostics, and please feel free to discuss it now. And in the end, and I want to reserve as much time as I see it's more and more people attending this session. In the end, I firmly believe that our, let's say, healthcare innovation is a location advantage for a country or for a region. I mean, and this has been clearly seen in this pandemic. I mean, if we look on Germany and our, let's say, very well-known car manufacturing industry, I mean, you cannot drive a car over a border from one country to another if healthcare is not functioning right. If healthcare does not permit. And I mean, people cannot relocate. Offices are not open. I mean, however, in any case, healthcare is, let's say, healthcare innovation is the foundation, and this will be also the foundation for, let's say, other economic success criteria in the future. So if this healthcare innovation is very good in the EU, fighting, let's say, or comparing it to Asia or America or whomever, then let's say companies will move there and work will be better and potentially faster in this region than in other regions. So do not let Europe fall behind when it comes to innovation in healthcare. Thank you so much, Barbara. Back to you, and hopefully back to your questions.
Yes, I see actually that people are very interested in what you are presenting, and there are already 3 questions. So I would like just to remind to all the attendees that the Zoom webinar has a function, the Q&A. You can see it down in the bottom part of your window. And if you have questions, feel free to write them there, or you can also mute them yourself and ask. I will start with the written ones, since there are already 3 waiting for you, Hans. So Diana is asking, what is the coverage of your product service and who can use it?
Yes, so yes, thank you, Diana, for this question. So we are CE certified. So at the moment, we are focusing on the CE countries, which is European Union, Switzerland, and Turkey. We're also working on the US to get it on the US market, hopefully in the middle or the end of 2021. And who can use it? So basically our customers are the labs, to be used by everybody. So we are not limiting it. So we want as many blood samples to be, let's say, processed in our system as possible to produce data on their quality and assure a super reliable result for the patient. So in the end, it's for the patient through a laboratory to be brought on the market.
Great. Then the second question from Dennis, I would like to know more about the business model.
Yes, so that's kind of, that continues with the first question. So, so we collaborate with lab chains in various countries. We have a subscription-based model. So for a certain amount of a monthly subscription, you can have our system to process as many samples as you want. And that works very well. And that is very good for the labs to plan. And it's very good to scale for all sites, actually.
Great. Then Diana has another question for you. How can the patients themselves trigger a diagnostic process?
Yeah, that's a super question. Diana, I see this, I actually see this as the vision of the future. At the moment, for example, a patient could trigger a diagnostic process, for example, if my Corona app recommends me to have samples been taken. Or, I mean, in Germany, we now have been, apps can be prescribed. So, for example, an app could recommend samples to be taken. You as a patient could also have, you know, by whatever means, the feeling, I want to get an answer on something. So and I think it will be a much clearer understanding for patients in the future that by diagnostics you get answers, because that's a great learning effect that many people had during this Corona crisis. So when they had Corona tests been done and they got an answer, yes or no. And so, and in the future, if you want to have an answer, you probably want to have a sample been taken. And so the initiative for sample collection will be much stronger at the patient. And it's unclear if the patient then walks to, let's say, a family doctor, or if the patient just walks to a collection center, which might be in a shopping mall or at a train station or wherever, for samples to be collected, and then the result or the information of the sample collection to be then broadcasted to a doctor or to an app that can evaluate it, also onward.
Great, thanks a lot. Then the next question is from Andreas. Thank you for the interesting presentation. My question is there anything like a good distribution practice standard, or is it anything coming up or changing for digital diagnostics?
I hope to be able to answer this. I mean, actually, a good distribution practice, I'm not sure actually what you mean, Andreas. I think when it comes, let's say, maybe you refer to, let's say, a data standard for digital diagnostics. So, I mean, if you mean that, then I would say, I mean, it's always clear as soon as you have patient data or patient-related data or even pseudonymized patient data, then it's GDPR applies. And you need to be very, very careful with whatever sensitive data that you have, putting the patient in the center of it. And I would say this is the first and the strongest rule that applies. And in the end, it's always the question with whom the patient wants to share his or her data. Who shall be the recipient of the data? So shall it be, as said before, shall it be your family doctor? Is it this way you want to have the data flow? Do you potentially want to have it flow to an electronic system for very fast interpretation? But that depends on the patient.
Okay. Then Diana is on fire. She has a lot of questions for you, Hans. So she has other two questions. Does it apply only to venous fresh blood or also to peripheral blood? And what about dried blood?
Yes. Thank you, Diana, for asking good questions. I mean, I like questions much more than, you know, than waiting for them. So basically, I think what we need is a system to monitor samples, whatever kind they are. If it's whatever kind of blood samples, whatever kind of swabs, if it's urine or, you know, other substances, we need to monitor them. And so I would say it applies to all kinds of blood, because for all of them, we need some really relevant data. We need to know exactly when was it taken, how was it processed, how was it shipped, does it match to a patient, does it match to an order, and once it arrives in my lab, can I automatically process it, or do I have to kind of treat it in any special way? So this is, so I would say yes to everything.
Okay, and there is an interesting comment question from René in the chat. I will read what he wrote. I agree that with Corona, me as a patient want to have an answer. I have an interest, for instance, boarding on an airplane. Hence, I'm in the driver's seat. But why should I, as a citizen, drive my blood urine collection process when I do not really know what the problem I have. The diagnosis is done by the doctor and he knows what to test, isn't it? I myself don't know, and Dr. Google is not this smart yet. So what is your comment to this question,
Yes.
Hans?
Yes, you're right. I don't think that you as a patient have to do more in future. So I don't think that you have to, let's say, drive a process, don't get me wrong, in any way that you kind of literally have to transfer anything from A to B. But what you will be able as a patient is you want to have more involvement in a process. You want to actually know what is happening to your sample. And you want to be able to decide if you want to have, let's say, just your family doctor interpret the result, or let's say your family doctor and a certain app that has experience in that. And I'm strongly against Dr. Google. I'm strongly against, let's say, of just handing over a result to a patient and say, here you go. This will not be, this should not happen. But I think that in future we will see different methods of interpretation, depending also on different situations where patients are in. And some patients will want to have, you know, a very fast answer, and they will trust, let's say, a very good and certified medical device app that can do the interpretation, and others who still want to go to their family doctor. But for some, let's say, maybe it's also a generational thing. Some people will say, you know, that takes too long driving to my family doctor, waiting in the waiting room. I want to have, you know, interpretation now. And they might consult a very good medical app, and that will give them an interpretation as well. And, you know, I think all methods are possible, but you as a patient, you can decide.
Good. And Diana has one more question for you. How much would the processing sample cost be increased by using your service?
Yes, that's a good question, Diana. If you want to have a clear number, call me directly, and then I'll give you the number. It is, however, clear that that the cost increase must be super absolute minimal, because for every I read what you say, because in the end a lab processes 10 or 15,000 samples a day, and so and you cannot invest a lot in the individual sample, but you must invest in the end, you know, in the process. So cost increase minimal, but data increase maximal.
Okay. So Diana is very, very interested in your solution, Hans, and she said she has even more questions. Since our time is coming almost to an end, I would like to ask if there is somebody else from the audience who has burning questions. Shoot them now, because we have just a couple of minutes to go. If not, Diana, you might have still time for one more question.
Or somebody else. I mean,
yeah,
up to you. But I liked it very much that this was an active audience that always speaks for the quality of the session one has.
Yeah. And yes, I think it was lively and good comments and discussion about what you presented, Hans, because you presented also like in a provocative way. So last question from Diana. Does it apply for self-sampling also? I cannot imagine self-sampling.
Yes,
from my
Diana,
case, for sure.
But... Diana, we should get in contact soon. Yes, you're absolutely right. I see self-sampling coming. I see self-sampling for not for, let's say, urine fecal swabs coming. I know countries where they're experimenting with it, and this could help labs and doctors actually, you know, in their process handling. This could be especially relevant for some population groups that we don't want them to actually move outside or move too much. But especially for self-sampling, we need an absolute sure process guidance and then super sure process monitoring. So, do we have all containers? Are they actually filled? Are they filled with the right substance? Are they filled, or is the patient filling them when they should be, like before eating something, at the right time? When is exactly the timestamp? And especially for some substances, can we link filling with transportation? Can we automatically notify the lab about the filling of samples? So yes, this is what we need, and this is what we will see part of the future.
Great. Just the last comment from Dennis. He suggested an integration with an AI app like Ada Health, for instance.
Yeah, there are many good apps that could be integrated there. But again, all these apps need information from diagnostics. I mean, it's so many great apps that have been developed, but you need to link them to this diagnostic backbone. And this is where I see a lot of the synergies in the future. And this is will come, and this is where all of these apps will profit from. This is where the patient will profit from. And this is where we need to go in the future.
Okay. Well, I think our time came to an end, unfortunately. I really enjoyed moderating this session. Thanks a lot, Hans, for your presentation, and all the attendees for being here and for your question. You will find all the contacts of Hans on the website of Smart4Diagnostics and also here. And I wish you a very nice afternoon.
Thank you so much. Enjoy the afternoon.